Okay, so we've made it through the content of the course. So good job making it through that. We're at the self-assessment portion. So I want to show you something that I think is really cool. I developed this tool based on the hundreds of people that we've helped with Medicare and all the calculations that need to be made, all the variables of what you need to consider. And we've plugged it all into this tool. It is in either an Excel document or a Google Sheets document. So pick whatever you prefer, whatever's easiest for you. I'm going to show you what it looks like. I'm going to use the Excel version. Okay. So here's the assessment. What you're going to want to do is just complete all these yellow cells here at the top. You're going to be locked out of all the other cells, so you can't screw this up. It's okay. So I'm going to go through this like I am just a hypothetical person new to Medicare. So answer these questions in whatever order you want, but top to bottom is A-okay. So the first question, do you get group health insurance from an employer that has 20 or more employees? It could be from your employer or your spouse's employer. Let's say the answer is yes. So you'll click to drop down, click yes. Do you have dependents who rely on your employer's health insurance? Let's say the answer is no. Do you currently get Social Security retirement benefits or Railroad Retirement Board benefits? Let's say no. What is your date of birth? Let's pretend it's September 25th of 1958. Okay, I got that in there. And because of Excel, you can put that in a number of different formats and it'll correct it. No need to be super precise about that. When will your current health plan's coverage end? If you don't know this yet, that's okay. You can either leave it blank or put in a date that maybe you know as an estimate might be okay. So let's say it'll be March 31st of 2024. How many years have I or my spouse worked and paid taxes in the US? This is getting into the cost estimate portion. So most people, it's going to be 10 years or more. So I'm going to click that. How did I file taxes 2 calendar years ago? So Medicare does look back 2 years to determine this. Just keep that in mind. I know that sounds a little weird, but that's just what it is. How did I file taxes? Let's say I did a joint tax return. What was my annual income 2 calendar years ago, that year that I filed taxes jointly? Let's say it was 182,000 or less. And then you don't have to commit to this decision yet, but you can toggle this and see and play around with it, see what the different answers are. Do I want a Medicare supplement in Part D or a Medicare Advantage plan? Let's say I want the supplement in Part D. All right, so I've finished, and then here are my results. So the first question that we've got answered here is, can I delay Medicare enrollment or not? And you'll see here that I've got the option to keep my group health insurance or switch to Medicare when I want. And then should I delay it? Because I said no to having dependents who rely on my employer's health insurance, it's going to say, okay, that's fine. It's probably worth you considering Medicare. So do the cost benefit analysis, keep going on. Enrollment, automatic or manual enrollment. I'll need to enroll manually when it's time to do so because I don't currently get Social Security retirement benefits. If that were the case, it would be automatic. The first day of my initial enrollment period is going to be June 1st, 2023. The last day of my IEP is here as well. And then if I choose to elect my special enrollment period, then I've got it laid out for me here. And then here are my monthly cost estimates. This is based on Medicare's annually updated premiums. And I've just put this all in here for you so you don't have to do the calculations. The private insurance plan premium, that's just an estimate based on the average national premium. So for this past year, the average person with a supplement and a Part D plan was paying $170 extra on top of the base Medicare coverage for that. So my total monthly costs here are $340.10. All right, so you can keep this, you can play around with it just based on different scenarios, and that's going to save you hours and hours of research and headache, and it's going to eliminate mistakes, most importantly. So that is the self-assessment. I highly encourage you to check that out. If you don't want to use those spreadsheet centered tools, then I'm going to pop back over to the presentation here and just show you the questions to go through. All right, and you can download this whole slide deck as a PDF and go through this yourself. So there's question 1, question 2, question 3.